Hi everyone, in this video you'll learn all about the SMC Nursing Program prerequisite requirements in just 5 minutes. If you're new to your nursing journey and want to make sure you're taking the right classes or you're planning to apply soon, this is essential information you'll want to know, so let's get started. Before you can apply to the nursing program, you must complete at least 4 key courses. These are English composition, anatomy, physiology, and microbiology. Let's break these down. English composition. First is academic reading and writing. So this course must be a college-level reading and composition course. At SMC, this course is called English C1000, which you may also see at other community colleges as well. If you've taken this at another university or perhaps at a state, it might be labeled English 101 or English 1A or Writing 10, and that's okay, as long as it's not a humanities or a literature course or critical thinking, and it focuses instead on reading and writing. Also, if you've earned a 3 or higher on the AP English Language or AP English Literature exam, that can fulfill this requirement too. So next up are the 3 major science courses, which I refer to as the big 3. These 3 prerequisites are anatomy, physiology, and microbiology. And these are the minimum courses you'll need for nursing program eligibility for an RN or even a BSN program. Now let's talk about the prerequisites for these prerequisites. Here's the catch. Before you can take some of these science classes, you'll need to complete additional courses, especially chemistry or often math like statistics or algebra. At SMC, you can choose Chemistry 19 or Chemistry 10. But Chem 19 is preferred since it's tailored for health science majors, since it contains general, organic, and biological chemistry all in one class. So for example, at SMC, you can't enroll in physiology until you've taken chemistry, since it's a crucial foundation to do well in physiology. That brings me to course sequencing. At first glance, it might seem like you're only looking at 4 classes, and some students think they could just, knock them out all in one semester and jump right into the nursing program. But here's the reality. Because of these hidden prerequisites, these courses need to be taken in a specific sequence, and that sequence, unfortunately, does take some time. While it's technically possible to finish in about a year, most students take closer to 2 to even 2.5 years to complete everything, especially if they're balancing work, family, or other commitments. A common course sequence looks like this. So someone may start with English, then take anatomy, followed by chemistry, then physiology, and finally microbiology. Taking your time and planning strategically will give you the best chance for success, not just getting into the program, but thriving once you're in it. There are many ways people take prerequisites, and it really depends on your strengths, time management, and study skills. Some students like to take chemistry with English 1 to get their feet wet before they dive into a more, say, high-stakes course like anatomy. Some students elect to take anatomy and chemistry together, but most students actually take these courses one at a time, more likely in fall and in the spring longer semesters, and that often feels a lot more comfortable, a very safe pace. I have observed as a counselor in health sciences since 2008 that most students succeed by taking 1 major science class per academic term. And again, that's fall and spring, sometimes pairing it with nursing-related general education or support courses. Just know that your path may vary based on your schedule, work, and other life responsibilities. So it's important to meet with the counselor to build your ideal strategic plan. So just a disclaimer about online courses. While we recommend students to take all their sciences in person whenever possible, we understand your schedule may not permit this. Remember that if you took any courses, and I'm talking any of the 3 science prerequisite courses after fall 2022 or later, post-pandemic, you are required to have an on-ground, which means in-person laboratory. Hybrid courses are okay if the lecture was online. Labs, however, must be in person, and we ask you to verify this on your nursing application. GPA matters. Yes, while it's true that grades really matter, on a good note, SMC calculates a separate grade point average just for the big three sciences: anatomy, physiology, and microbiology, which directly affects your point total on the multi-criteria admission system. We do not calculate a cumulative GPA. So if you have transcripts from years ago that you're not so proud of, it's okay, since we're only calculating a GPA for the big three sciences. And this doesn't include chemistry or biology or any science like that. So if you have not yet started your sciences, think of it as a fresh start for you. The grade in your English, reading, and writing course is also considered in the point total on the multi-criteria admission system, which we'll cover in a separate video for you. Final thoughts. Planning your prerequisites, it's not about just meeting requirements. It's about setting yourself up for success in the program. Why? I mean, in order to thrive in medical surge, which is your first course, as well as your clinical setting with actual real patients, a solid foundation in anatomy, physiology, chemistry, and microbiology is crucial for a nurse because these subjects provide the essential understanding of how the human body functions, how diseases develop, and how treatments work. Knowledge that's vital for safe and effective patient care. You've got this, and we're here for you in health sciences to support you every step of the way. See you in the next video.